Welcome to the Depth Perception Podcast,
We go in depth about the perception and misconceptions of optometry,
which include the business of optometry,
social issues within optometry,
and life as an optometry student.
coming straight from Dr. Jasdeep Singh Soni,
Dr. Nadia Afghami,
Dr. Douglas Akiti,
And Dr. Svetlana Nunez. We hope you enjoy this episode.
Hear ye, hear ye. We are back for another one. Welcome, guys, to the Depth Perception Podcast. What's up? How y'all feeling today?
feeling great. We got the magic people here. We got a great topic.
It looks like Svet is trying to talk and her mic looks broken.
I know, it's like not letting me talk.
There you go. What's
How about
up,
now?
Svet? How you doing?
I was going to say I'm feeling tired.
Okay, that's fair. That's real. We like to keep it real here on the Depth Perception Podcast.
100%.
But you know, it is what it is. We keep it pushing, right?
Sorry, my husband came to see me for the first time all day. So
How's the married life? I mean, to say husband,
married
that's
life.
lit.
Ooh, I was napping, so I took my ring off.
Whoa, yeah. Are you married?
No, if Noah Centineo asked me, I would say no.
Got it.
You got married on my birthday. It's a big deal. So
It is a big deal. It's almost the anniversary of your birthday again.
and guess what? I have another friend getting engaged on my birthday. What's happening? It's actually crazy.
It's a
I guess your
popular.
birthday is just a really good day. It brings
Okay.
good luck.
I agree.
I'm gonna wait until next year to have a baby so I can have it on your birthday.
Well, that's perfect.
Okay, that works. I don't know if that works. Yeah, I don't know how I feel about that actually.
He doesn't want to share.
You need to talk it out, Doug. I think sometimes when we have hard struggles and we feel bad, we just gotta talk out. We gotta talk it out to somebody, like a special
Yeah,
person who is like qualified to have these discussions, like a coach,
like
therapist.
a therapist.
Yeah.
Therapist.
You know what? That's crazy because that brings on the topic of today. Optometrists or therapists, who are you guys? What are we?
We're a little bit both.
What are we?
What are we is the question.
JD, talk about it. Let us know about your
Let's talk
experience.
about it. I guess when I walk in a room, I
Yeah.
say, "How are you?" And then they take it wherever they want to take it. And sometimes I'm like, you know what? Let's talk about it. This has nothing to do with your eyes. Let's talk about it. How was your weekend?
I think my biggest thing is that you say, "How are you?" and they start going on a tangent. So, like, what do you guys do? Are you like, "Oh, yeah, keep talking, but read the letters"? Or are you doing like a cover test while they're talking? Or like, are you going to put the phoropter in there nearby the face and keep talking? Like, what do you guys do?
Nadia, go for it.
I am a very kind person in general. When my patients talk too much, I'm on a schedule. And I'm not good in the exam room when they tell me something, and I just am like, I don't know how to explain it. Like they'll be like, "Oh, I'm really sad." It sounds really dense, but they'd be like, "Oh, like I've been crying, like my mom died," and I'm like, "Oh, I'm so sorry to hear that. Do you want to hold hands?" And then while we're holding hands, I'll just start the exam because I don't want to let them finish talking because that's going to tangent the exam. So I'll be like, "So have your eyes been?" Because I'm not good at being their therapist. I'm not really that great at it.
How many exams have you held hands in?
4? Yeah.
How long
My love
did the
language
hand-holding
is
partake?
touch.
How long?
I mean, like however long they need it. However long they need it, like at Disneyland, like, the characters hug you and they don't let go until the child lets go, right? It's the same. So if they're ready to move on, then they'll let go.
This was like inspired by Disney.
Right. Everything is.
Okay, so your solution is keep going and hold hands.
Yeah.
What do you do?
about
Doug?
you, JD? Ditto, you owe me a soda.
We said the opposite names. Anyways. All right, fine. I'll go. I kind of try to do exactly what I just did. I redirect and transition it where it's like, great. No, I'm glad you had a great weekend. So I want to make sure this week keeps going good. Let's check your eyes then. Like just transition whatever they said into what I want to do. But here's the thing. Listening is important, right? So I don't want them to feel like I didn't listen because I feel like, I don't know about you all, when a patient judges you, this is how I feel. They judge you not based on the work you're doing. They judge you based on how good of a time they felt and how personable you were with them. So that is super important to me, right? Like sometimes I talk more than I even do exams and they're like, wow, I had such a good exam just because they had a good conversation, right? I don't say misidentified. That's how humans value each other. So what I do at the end is I ask, do you have any questions at the end? And I try to chit chat then too. But my recommendation would be redirect by using what they said and connecting it to doing the exam and continue with the exam, so you feel like they were heard. That'd be my thought.
Right. Yeah, because it's like we do want to be personable. We want to let them know that we're listening, but we also, like Nadia said, we have a schedule. So we can't just like listen to the sob story or the situation or whatever it may be. So I do like that redirect thing that you do, JD. I feel like for me, I I do take moments to listen. For me too, I have a lot of Spanish speaking patients, so it makes it kind of easier to just like keep going because it's like I'm like, oh, okay, yeah, okay, okay. So like, ¿cuándo es su último examen? You know, just like change the subject in essence. But also like, I think it's very necessary to stay personable and listen because a lot of times these patients don't have someone to talk to and they're just looking for a quick little outlet to like talk about what they have going on or what they've had going on. And I definitely take moments, especially when they're talking about their health history and things that have happened, like if they've been going through a lot of things, like I really like try to listen and then make sure I give recommendations to whatever may be going on, like high blood pressure, for example. What about you, Sven?
I think I find myself relating a lot with JD when he was saying that patients, or at least the patients that I've had, they relate a lot based off of like their experience or like how they felt with you after the conversation. So I think I try to give them space to talk, but also to give you guys an example, like, oh, okay, something happened recently, or they're talking maybe about their eye health, went to the ophthalmologist, but maybe they're just here for a refraction, something like refraction only with optometry. So then they're here to talk about everything going on with their eye with the other specialists. And I'm like, oh, yeah, well, that's really interesting. I have more questions about that, but let's just check your vision really quickly. And then we'll talk about it in a bit. And they're like, "Oh, okay, we're gonna come back to it." And then, like, once I'm done with, like, a quick refraction and I'm inputting the numbers, and I'll be like, "Oh, wait, so can you tell me again about this?" And they're like, "Oh, yeah, she remembers," you know? But it's only been 5 minutes, but I needed to get those 5 minutes, and while I'm typing and printing out things, then they're sharing and they feel better or they feel heard. And then I'm listening, adding that to the history, filling out the rest of the chart. And then it's like, "Okay, well, that was great. Thank you for sharing. Maybe this happened, maybe that happened. I recommend this. We can refer you here for something else, blah, 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 blah." You know? I guess that's
Yeah.
how I kind of go about it. I try to redirect to maybe come back.
So what do you guys do when there's like a sob story or something like really sad and you're still trying to do the exam? Like, how do you guys handle that? JD, you want to go?
Then I probably listen because when you say stop story, what came in my head was I don't know. People mention their partners dying. I feel like very often, or it feels maybe we see a lot of presbyopes, and a lot of presbyopes are more likely to have their partner passing away, and so I feel like it comes off at least once a month, if not once every couple of weeks, where someone passed away in someone's life. And so I say I'm really sorry for your loss. I wish you didn't have to go through that, and then hand them a tissue. And then I ask them, "Are you okay? Would you like a couple minutes so I can go to the other room if they need to?" That's my strategy to give them some room to breathe, and so that could work as well. Maybe give them a couple minutes to breathe, or then you say, "Hey, like, I guess would it be all right to continue on? I know you're feeling bad about what happened. I understand that's really hard. Maybe you just sometimes I think just say it out loud. Would it be all right if I continue? Just giving them space and asking. What do you think about some of those things? What do y'all do?
I have a story.
Tell us.
I was at the community health clinic and I did an exam on a patient. And this was when I was a student. And then basically we diagnosed her with glaucoma. She's been seen multiple times. And then this was like one of those glaucoma visual field OCT follow ups, right? So then officially diagnosed her with glaucoma, put her on latanoprost, and then she came back like 2 weeks later, 3 weeks later. And then there was like a hallway, so I had to walk a while. Once I called her name, she came up to me and like crying in tears. And I don't know, first reaction was like, "Oh, do you need a hug?" And because we had like a long walkway to the exam room, so it's like you can't just like cry all the way. And then I remember it was, like, shocking, and then she was telling me that she was crying because her eyes were really red, and that everyone was asking her if she had, like, issues, just because she had really bad red eyes. And I was like, "Oh, okay, okay." So I think from there, That's a little different because, like, we weren't in the exam room just yet, but I think just being natural in your response, I think for me it was natural to, like, offer a hug and then kinda giving the patient some time to calm down, and then we walked to the exam room, like, she was ready to be examined after that. She just, like, needed to express the initial emotion that she couldn't express, like, with her family.
Well, it's tough, right? Because we're asking about, obviously we're asking about eye stuff, right? But we're generally asking about health. Generally, your whole health affects your body, which affects your eyes, right? Like I don't know how you like if when you guys looked at entrance testing, haven't you seen they're taking some sort of anti-anxiety pill or it says they're depressed? Have you seen that? And I'm like,
Mhm.
man, like what do you say? Do you address this? Like Nadia Doug, like what do you feel? Have you seen that in the entry and like how do you react to that? Like I don't know. Have you seen cases where maybe mental health affects how much they're accommodating, or I don't know, whether how high their IP is? Any thoughts on any of that kind of stuff?
I'll just say, like, as it relates to mental health, last year I was working as a super tech in Beverly Hills, and like different types of clientele, but a lot of people who are like CEOs and this and that. So this one individual, this guy, I was like prepping him and like doing the workup, getting the intake and all that, seeing the medications. And I don't remember how it came up, but I don't know if I just asked him like, how's it going? I think I just asked him like, how's your day or how's it going? And then he just was like, it's not going that well. And I was like, tell me about it. Like, what's going on? And he just like told me that his son committed suicide like the month prior or something. And it's just been like tough for him and for the family and everybody. And he was like, his son is so smart and he went to like this prestigious school and all these things, but his son just felt like he had to do it and he left like a note and it was like very calculated. And he just like expressed all of that. And I was just listening and I'm just I'm really sorry to hear that. I definitely understand how, what loss is like. I mean, it's different because that's your son, but my mom passed away too. Like, just trying to like make it relatable. But he was like really thankful after that I just took the time to listen. And he told me, he was like, thank you for listening. Like a lot of people don't do that. So I really appreciate you. And then he told the doctor after as well. So, you just have to try to be there for them as best as you can, whether it's just acknowledging that you're listening, putting in your own input to show empathy, things like that, I feel like are helpful. What about you, Nadia?
Well, nothing like that's happened to me. Good, because I don't know, I feel like because they are probably thinking about their loss so much that when they come into my exam chair, I try to make this about that, right? Like, "Let's make this about you. Like, we gotta take care of you right now. Like, let's take care of your eye health. Like, I know you're going through all this stuff." So I think, like, when they're like, "Oh, this and this is going on," I'm like I listen a little bit, but then I'm like, "You know what? Like, well, let's get you going. Like, let's take care." Because they'll be like, I've been going through so much. Like, my so and so has cancer, or like, we've been at the hospital and I haven't had time to come in. It's been a couple years. And you're just like, well, let's just take care of you. Like, how are your eyes doing? Whatever, whatever. But I never like open up the therapy box because I'm not a good therapist. Like, I'll listen, but again, like, I think that when I'm in the exam room, like, have a script that I'm going at, and the only time I'll deviate is like when I'm putting in codes at the end, right? Like, that's when I'm like connecting with them. And I think that again, if I was going through something traumatic and I came to my doctor's appointment and like if I was trying to like do a thing, then maybe I wouldn't want to think about it as much. Flip side.
That makes
Yeah.
sense. Go ahead.
I was just gonna share, I think it's interesting how we all go about it in different ways. I think it's cool to, like, learn from each other. And I think I relate with you too, Nadia. I think there's some patients where I go the same route almost, like, "You've been through a lot. Let's focus on you." And just that, they're able to enjoy the exam, get a really good exam, and they feel great knowing that they're gonna have, good glasses and their eye health is in check.
The best thing we can do in these situations is just make their experience in this moment, in this time, be the best time that they have. Like try to make them forget. So things that I like to do is like crack jokes or, just make it a great experience for them so that they can take like these, 15 minutes to not think about all the crazy things that's going on in their lives.
I think too, it's like you have to, even if it's not like a therapy session, like a dramatic one, right? Like, I think that as practicing like optometrists, just in any medical field, even, right? Like, you change your personality to cater to the patient in your chair. Do you guys do that? Because I don't do the same exam on like a Gen Z that I do on a boomer, right? Like, it's not the same kind of vibe when I go in. So if I'm getting like the sense like, this girl like really likes Taylor Swift or whatever, right? Then it's like a different exam, right? You're like, oh, we're best friends. Like, you're just trying to build that rapport versus like, oh, someone's grandma's coming in and you're like, how's your knitting? Like, any good recipes? Like, I don't know. You know what I mean? Like, you're
Knitting,
like, you're not talking about the same things. So like,
for sure.
I think that we have to make that judgment call so quickly. And I think that when I go into the room, I'm already like, hi, I'm Dr. Afghani. Like, how are we today? And whatever that response is from them, it like will determine what kind of exam it is, right? Like, if they're in a bad mood, you're already in a bad mood, right? Like, you know, like, oh, this is going to be like a short exam. Like, if they're trying to fight me on something that like they had cataracts and I told them to go to the cataract surgeon, they're like, I can't see out of my glasses. And they're coming in there with attitude, you know, you're like, okay, well, now I have to put my big girl like white coat on and be like, okay, let's, you know, or if they're like a new patient contact lens, it's like a ortho K, it's a child, you know, you approach it differently. And I think in our profession, in order to be good professionals, like, you have to cater to all those personalities. And I think that's what makes them think that we're such good therapists, because we're trying to mirror them. Does that make sense?
You know what I think is interesting? I always thought that that was almost a bad thing to do, especially when I feel like going back to my high school, college times when I would do princess parties, I would mirror like the party, right? And I had that skill and then brought that into optometry, being able to mirror patients. And at some point, maybe because I was a student, but let me know what you guys think. At some point, I was like, who am I? What part of me actually stays present? You know, like how much mirroring am I doing? Do you guys ever question that or feel, I don't know, a disconnection?
I think it depends. I think you just have to gauge it, kind of like Nadi was saying, because some patients you'll see that, like, for example, like the Gen Z example. Like, I just had a patient who was like 25, and so I feel like I could use more chill terms, like, yeah, bro, like, what brings you in today, man? Like, just keep it chill instead of like, hey, sir, like, how are you doing today? Like, good morning, like, you just gotta cater in to the person, but still be yourself. Like, it's not being fake if you're just being more formal or less formal. You're just being you in different situations. That's like saying, are you gonna act like Obama if you're on stage, or act like you but still be formal while being on stage? You know what I mean? Eddie, what's your take on that?
Complicated, right? I think you at the inner mirroring, you still have to be yourself. You got to be authentic. Like, all of a sudden, you shouldn't be changing, what you're interested in. But when you're mirroring, you're speaking in a way that is getting your audience to listen. Something in a way that's salient for them to understand the message that's important for them. So I think it's a great thing overall. I think we all kind of subconsciously do it. I think when you walk in the room, if it's a guy, be like, "Hey, nice to meet you," or like, your voice goes deeper, right? Like, it's part of being human, right? Like, people want to talk to people who they share values with. So I don't think it's a bad thing if it makes you a better doctor, gets your message across stronger.
What about you, Nadia? What do you think?
About which part? The part about mirroring?
Yeah.
Yeah, I mean, I mirror. I mean, I think I subconsciously do it. I think if you're confident in who you are, then mirroring is not like changing your personality. I think every time we do an exam, we're playing a role. I think I say like every 15 minutes I'm doing the same show again, right? Like, I have a routine, I have a script. And so like, it's take one, take two, right? You're not going to take every take the same because everyone's a little different. So again, like going into an exam talking to um like an older patient versus a younger patient, even, or somebody who does maybe have depression versus somebody who's very bubbly, like those kind of personalities you have to mirror, because if somebody's depressed, you can't be laughing. Like, I'm not going to be making jokes. Like, that's not going to build rapport with my patient, that's not gonna make the exam go well. They're going to be like, why is this girl like this? Right. So I think we have to recognize patient needs in such a short amount of time, right? We're on with our patients like 15, 20, 30 minutes, right? And we have to use that short amount of time to really like build ourselves and show them like, hey, like I'm someone you can trust, right? So just I think mirroring helps do that. And I think maybe that's why they like feel so comfortable talking to us sometimes when they have a bad day or they're having like a rough time because they feel like we're their friends, which is fine because we want that in a way to like be like, hey, I'm your friend.
No, it's cool. We talked about mirroring, and I think we talked about some strategies to keep the exam going. Obviously, we have a goal, which is to do their exam, and we have other patients we got to see and stuff like that. But isn't there also, like, to end it, like good opportunities where listening to them and being their therapist can also be helpful or is like relevant? Like, I'm sure you've had those instances, hey, I can't do cataract surgery, I don't have medical insurance, like, and they're saying it in a different language, right? Or hey, I can't afford to go see a specialist, I can't do a RNFL or get topography or whatever it may be. And so like it is relevant to be like, hey, no, I understand, take your glasses for prescription even though you're 20/80 and you can't afford it. If you don't want to go, I get it, you can't. You're like, isn't there some part of us that should be part of their therapist and coach in that sense?
I think that this is the reason why, like, it's important to be social being an optometrist. Like, you have to be able to talk to people and know how to talk to people. Like, if you're an awkward person, and there are people like that, but I feel like you just don't get across to the patient as well as if you know how to engage and like talk to people. So I think that's just, it's really important to be social and be understanding. Like, we as optometrists are like super compassionate, and this is, you know, probably one of the top reasons that a lot of people become optometrists. So I think it's very important to just be sociable and be relatable and understanding to patients. What about you, Svet? What would you say?
The first thing that came into mind, I honestly already lost it. Give me a second.
What about you, Nadia?
I know we said before the pod, but like sometimes the patients are my therapist, right? Because like even today I was like, "Oh, I really like this stroller she brought in her baby." And I was like, "I love this stroller. What kind of stroller is this?" And then I went on and on about how like I want a baby. So I was like, "I already have my stroller picked out. Like I'm going to get this one." She was like, "Yeah." And then but she was so nice cuz she's like, "Oh, let me show you how this one works." Right? Like I don't have a baby. Like we're not even close to having a baby. But I was like, "Yeah, I already have my baby name picked out, you know?" So I feel like, again, like when you mirror them and you're friendly with them, like you get something out of it too, right? Like it's not all one sided. Like there's patients that we love to see every year because they bring us joy, right? And there's patients that we're like, oh my God, so and so is coming back. Like that's going to drain my energy so much. And I think like it's important to have that balance in a relationship that is your patient doctor balance too. Like you guys are building like again a bond, and just the give and take is very important in the exam room because we see so many people. We can't have everyone drain our energy all day. Like that's not what this is about, right? So I'll be like, again, where are you from? Oh my God, yeah, I just moved from Florida, I got married. When you tell them about yourself too, when you open up to them, then they're like, this is like a real person, this isn't just like AI, right? This isn't just like an auto refractor that I could have used on 1-800 contact, right? Like it makes them think like they're being heard because you're also sharing part of you with them.
I remember what I was going to share. I think when you're relatable, like what Nadia was describing, and then you get your patient to open up, you actually allow them to open up and share more about their lives that could actually be affecting their eyes. So I think that, you try to do your detailed case history. You try to read the charts beforehand. In some clinics, like their medical chart and their vision, like if it's my chart, you can see everything, right? But then there's times where you don't really have a lot of information, you're just going off what the patient is telling you. And as you're getting more and more relatable with them, then they're sharing, "Oh yeah, like I actually have this autoimmune disease." And you're like, "Okay, well, you didn't share that before. Maybe refresh is not going to work for you." Like I just told you to use refresh, but like JK, I don't think that's going to work. Or I'm thinking of patients that have like systemic diseases that they shared with me later on. And I asked them if they were taking medications, but then they shared it later on. So I think when you build that patient relationship and you're listening, but you're also trying to be efficient and you're finding that balance of mirroring You're finding that balance of saying sir or saying bro, like you're just able to get closer to your patient and then they're willing to share more. I find that a lot of patients don't want to share a lot about their medical history at an eye exam because they don't understand the correlation with like eyes, vision, eye health, and then the whole body. And that's normal. I think sharing, explaining, advocating, listening just helps your patients. But making them feel comfortable and heard is step one.
Great job, guys.
No,
I'm going to come to
great
you for
topic.
my therapy.
Who's actually been in therapy? We're going to talk about that.
I have.
You've never done therapy, Nadia?
I'm not broken. I'm kidding. Joking.
That's why you're looking at your patients to get it.
This is why she can't relate. No, I'm just kidding.
She doesn't need a paid therapist. She just
I already
sees
know
her
what's wrong
patients.
with me.
She's one of those.
If I already
One
know,
of those.
I spent a lot of time being an only child, like my whole life. So I have a lot of like me time and me searching and what's, cultivating and what's serving me and not serving me. So I haven't felt the need yet, but I would. I mean, if I felt like I needed it and I needed someone to talk to, I think I've been very blessed with a very good group of friends, a lot of them present in the pod right now. If nobody knows, like every pod, like right before it, we have like a vent session about like, hey, what's everyone? This is the Brady Bunch. Like, how's everyone been? Let's have like a 5-minute vent sesh or whatever about your lives and then whatever. So it's nice. But like, and not to say that like you shouldn't seek therapy if you feel like it helps.
I
With
think
that being
therapy's
said, does anyone want to share a last piece of advice that we should give, our future doctors, our people who are in these shoes of having to give this advice or be, the essence of therapists while being optometrists?
just make sure your patients feel heard. And if you don't have the time to go super in depth as much as the patient wants, just make sure you address that and make sure that you don't make sure that they don't feel like they were not listened to at the end of the day, no matter what you do. And that would be my little takeaway.
Yeah. I think as optometrists in general, as practitioners, we just wear a lot of hats. So we have to know which hats to wear when. And being a therapist is one of the hats that we do wear at times.
Not you, but generally.
Not me. I mean, I'll use it as a therapist. I'll be like, you're the therapist today.
Ooh. Do you make your patient refract for themselves too?
No, but if I'm going through trauma, I'm not good
Keep
at
that
hiding
hat.
it.
Keep that hat. Yeah, keep that hat. Keep going.
I feel like people don't like their doctors because of the medicine they prescribed them or the glasses that they gave them or the dental cleaning that they gave them. People like their doctors for being personable, for being relatable, and for being down to earth. So I feel like just remember to try to do those things when seeing patients, but also you got to keep the exam going, but take the time. Because, what does 2 minutes, 3 minutes, 5 minutes, it might push you back a little bit, but that patient will feel way better. They'll feel heard and feel seen, and they'll definitely see you again.
Yeah, I think you guys covered everything. I'm just going to go off of what Doug was saying. I think majority of us have the issue of going too fast versus going too slow. So if we're always going too fast, you can take those 2-3 minutes to just kind of sit and listen and take time for your patient to feel heard.
That being said, that's another podcast. Guys, make sure y'all subscribe, like, hit the button, smash it, do the thing, follow. We'll see you on the next podcast. And with that being said,
Hey guys, thanks for listening to the Depth Perception Podcast. Don't forget to like and subscribe on all of our platforms, including
Spotify,
Instagram,
Google Podcasts,
Apple Podcast.
YouTube. Make sure you click that button. Double tap that.
So you guys have no reason not to follow us and tune in to the next episode.
Stop wasting time.
Get in depth.
Subscribe.